American Indian contributions oral birth control. Oral contraceptives are substances taken by mouth to prevent pregnancy. They work by suppressing ovulation. North American Indians were using oral birth control in the early 1700s, more than 200 years before Western medicine invented the birth control pill. John Lawson, who wrote A History of North Carolina in 1714, told his readers that the Indians living there have an art to destroy conception. The indigenous people of North America discovered birth control independently from the Egyptians. Western physicians who had dismissed the Egyptians' recipes as useless nostrums or home remedies ignored anthropological reports of American Indian oral contraception as well. They continued to instruct patients on barrier contraception, which blocks the sperm from reaching the egg, and on the rhythm method, timing intercourse so that it does not coincide with ovulation. Many dismissed the idea of oral contraception altogether. As late as the 1936, Norman Himes, the American author of The Medical History of Contraception, reviewed literature on the American Indian use of oral contraception and wrote, "For no drug has yet been discovered which, when taken by mouth, will induce temporary sterility." One of the herbs used as an oral contraceptive by the Shoshone Indians who lived in the Great Basin of North America was the stone seed. Medical researchers tested this and other American Indian oral contraceptive plants in the 20th century and found them to be effective oral contraceptives. For example, the Potawatomi of the Northeast used the herb dogbane. When scientists invented an oral form of birth control in the 1950s, the high-dose hormone-based pills that were first prescribed were shown to have many side effects, including the chances of cancer. In the late 20th century, pharmaceutical researchers began to explore the medicinal uses of plants containing substances that act in ways similar to hormones. One day, they may reinvent a plant-based contraceptive similar to those that of American Indians used. Cotton root was used as a contraceptive by chewing on the fresh root bark. To induce the abortifacient properties, the root and seeds were used in a decoction. As the word about cotton root began to spread, the white doctors, they began to use black haw to stop the contractions of miscarriages or abortions already in progress, until physician W. W. Durham noticed at one period in my practice, the Negroes used cotton root so frequently to produce abortion that my supply of black haw became exhausted. It is not fathomable that the supply of black haw could keep up with the bounty of cotton in the plantation South. Cotton root was also used to induce labor and stimulate contractions in childbirth or to bring on tardy menstruations.